Welcome back. After quite a bit of criticism, the state of Michigan is changing its protocols for nursing homes during the pandemic, including the creation of care recovery centers. Let's talk about it with the director of the Michigan Department of Health and Human Services, Robert Gordon. Mr. Gordon, really good to have you here today. At the start, I want to talk about what I've mentioned a couple times on the program, and I'll see if you agree with me, but what I think a lot of this has shown us, it's kind of exposed a gap in the American healthcare system, hasn't it? A stop between a hospital and going home.
Yeah, well, I think COVID exposed a tremendous number of needs which unfortunately the country wasn't fully prepared for. But yes, I think that we have learned about the extraordinary risks which face older Americans and Americans when we're facing a pandemic like COVID, which is an infectious disease which attacks people with pre-existing conditions and attacks people who are at particular risk, and older folks are at the top of that list.
These care recovery centers, they're kind of outlined in the executive order that was issued this past week, but I'm not sure we really quite understand how these are going to work. Surely we have a number of nursing care facilities we've already seen in the state that would not meet the qualification requirements for it. How will these be created?
So it's important to step back. These are not a dramatically new idea. This is an evolution in a policy that we laid out in the spring. And the idea behind the policy is that when someone has COVID, we want to make sure of two things, particularly an older person in a nursing home or a person leaving a hospital who needs to go to a nursing home. One, we want to make sure that person gets the care that they need. And two, we want to make sure they get it in a setting where they aren't going to infect others who don't have COVID. And we did it in the spring with a policy called hubs, and we've now evolved that policy into what we're calling care and recovery centers. And the basic idea is that it needs to be in a facility that can meet certain particularly strong criteria for protecting people. So for example, there would be a separate entrance or a separate wing with a separate nursing station. There would be levels of staffing that meet particularly high standards for quality, and there would be an inspection on site by infection control experts. And that having done all of that, we would feel a special degree of confidence that this was a safe place both to care for someone who is infectious and to protect people who are not.
You've heard so much of the criticism, of course, that really boiled over this past spring when we saw so many of the fatalities that were occurring in Michigan were happening in nursing homes. And to a lot of people, it seemed nonsensical to put COVID-positive patients with non-COVID patients together in these facilities. Is this new step, is this any kind of, I don't want to call it an admission, but is it at least a realization that maybe that wasn't the best way forward early on in the pandemic, even given that we didn't know a whole lot then?
You know, I think there's been a lot of criticism from folks who haven't looked at the actual data for how Michigan performed. Michigan was incredibly hard hit by the virus early on.
Yes.
At one point, we had the third most deaths from COVID in the country.
Right.
Because of hard decisions we've made, because of Governor Whitmer's insistence on wearing masks, on social distancing, on taking aggressive steps to close down in the spring, steps that were widely opposed by the people who are issuing criticisms now. Because of those steps, the level of death in Michigan has declined relative to other states. We've gone from third to ninth. And when it comes to nursing homes, we once had among the most nursing home deaths in the country, and we have steadily declined. I testified in the legislature a couple weeks ago. We ranked 18th in deaths for nursing homes. I checked just this morning. We're now 23rd in deaths in nursing homes. So I think there's a lot of criticism from folks, but if you look at the data, given that we were very hard hit early on, we have performed quite well.
It has, especially, and as other states have now dealt with their own sort of climactic moments as this has gone on. I want to ask you about these makeshift facilities that we've tried with TCF and the suburban showplace in Novi. Dr. Caldoun told me on this program about 2 months ago that we came to realize that they really were kind of imperfect answers because, for instance, if you've ever walked around the auto show and you're standing in the middle of the floor, you suddenly realize you're about half a mile, it feels like, from a bathroom. That doesn't work for a healthcare facility. So are these going to be answers, again, because you've left that possibility open in this order, or the governor has, are these going to be workable answers should we get hit with another real surge in cases?
Yeah, the alternative care sites do remain a possibility if we have a huge surge in hospital needs as backup for hospitals. We really hope that that doesn't happen and people are wearing masks and socially distancing,
Yes.
and washing their hands. And by doing those things, we don't have that need. When it comes to nursing residents, it's what you said. I don't think those facilities are the right places for someone who needs to be in a nursing home. They don't have the level of care. As you say, the bathrooms aren't close enough. They don't have the level of structure to keep people from falling. So that's why we have moved, as we did in the spring, to care and recovery facilities, which are built out of existing nursing homes, but have the kinds of protections and staffing and inspections that we can feel good about their safety.
Robert Gordon, the Director of Health and Human Services for the state of Michigan. Robert, thank you so much for the time. Stay well. We'll talk to you again soon.
Thanks for having me.
You bet. We come back, we'll talk about the merger that is no more for Beaumont Hospital. This is Flashpoint on Local 4.